Dr. Ghatan, what is psoriasis?
Well, psoriasis is, for the most part, a genetic skin disease. It's quite common. They say it's about 2% of population, but my estimation is probably much more than that, maybe 5% or more of the population who has at least the gene for psoriasis. They may not manifest the rash of psoriasis. It's very common, and you find these red scaly plaques on the elbows, on the knees. It could be on the scalp, or it could be on other parts of the body, but the most common areas are elbows and knees. They can affect the nail. You can see little dots of depressions on the nail. They can be very severe on the scalp, and you see this white flakes on people's clothing and jackets and stuff. It could be embarrassing sometimes. It could be difficult, especially if it's involving large areas of the body. And people get some social stigmatization, and they're sort of avoided. People don't know what it is. They're afraid it may be contagious. It is been found recently to have been associated with increased risk of cardiovascular disease and diabetes. There are people who have arthritis that is related to the psoriasis, which is called psoriatic arthritis, which can affect the joints of the body. Basically, in mild cases, the skin problem, we treat them with topical steroids or intralesional steroids or vitamin D derivative creams. There are some tar derivatives that are quite effective for treatment of psoriasis. Most recently, we've had a laser treatment available to us, which is quite effective, not painful, and fortunately, a great majority of the insurance companies cover this service, and it's done in the office. Again, there's no pain. Patient comes in usually twice a week and gets the treatment and goes home and uses the cream at home. It takes usually about 6 weeks, usually approximately 12 treatments to help the psoriasis clear. And once it's cleared, it stays that way for about approximately 6 months. We find it extremely helpful for people who have psoriasis on the palms and soles. Those areas are very difficult at times to treat, and this treatment is a great asset that's available now to us.
So you're telling me that a patient comes in, has to come basically for 6 weeks. That's almost 2 months, and then he's only relieved for about 6 months, and then he has to come again for a 6 months treatment, and that keeps going for the rest of his life. Or did I misunderstand that?
Well, it is going to be effective at least for 6 months. It may be much longer than that. It's not predictable how the patient is going to respond in the future or what's going to happen. There are factors that bring on psoriasis. For example, if you have somebody who has strep throat or some other infections, that could trigger the psoriasis to come back. If a person is under stress, it can trigger psoriasis to come back. So there are a number of factors that play a role in this, and it's hard to tell how it's going to be. The previous treatments, like we used the UV lights in the box, we put people in the box, and they used to have about 23 treatments. It was done about 2-3 times a week, and that was also not a very long-term cure, maybe about 6 months or so. But again, we were exposing the whole body to this UV ultraviolet light. In the long term, this could have problems with skin cancers, increased risk of skin cancers and such. But with the laser, we are only applying the laser to the areas where there is psoriasis, so we are avoiding the normal skin. So the chances of having those side effects is much more reduced.
And the time is reduced because the other one was even longer. And obviously,
Right.
since you mentioned that it can really cause it, it's quite, that's quite enlightening actually, on how many other problems it can cause.
Right.
Wow. All right. And it probably, is it uncomfortable also, itchy and whatever? Is it, do people scratch it when they have it, and that in itself is getting all kinds of impossibilities of infections and all that things?
Yes, that is a possibility. Commonly, it's not very, very itchy, but in some people it is, and it can be uncomfortable, and it can get infected if they scratch it too much and break the skin barrier and cause infections, sure.
And if it's in areas where the skin is exposed, like I think you mentioned, it can be in the head or somewhere, or even if it's on the knee, and whether it's a boy or girl, and somewhere we wear shorts and miniskirts, it's unsightly also, right?
Right. And again, it becomes more of a psychological, embarrassing situation for the patient, and that's something else to consider.
Sure. Well, again, thank you very much. That should shed some light onto the people listening to it. Bye-bye.